We're live, guys. We are live. Um, I'm early. I want to wait a few minutes um, and wait for Beverly to join. But welcome in and hang tight. Yeah. So as we wait for Beverly, this is the second to the last uh, Substack Live for this particular series. This reproductive health series is almost coming to an end. So if you have not watched parts one through three, please do. Um, Depending on Beverly's schedule and the engagement of the audience. Oh, there she is. Oh my God, you're early.
Hey,
You got it right.
yeah.
Um, So yeah, I logged in early because I wanted to make sure if you was gonna be able to log in. So I always log in like 15 minutes early just in case something happens. So with that said, we can kind of get started kind of early since you're here.
Oh,
Let's
absolutely.
see. Um, so as I was saying that this is like the second to the last of our series, and parts one through how many they can go watch it. It's like it's 3 hours of good information. Um, I also want to say engagement is important. It kind of helps me navigate what questions to ask and what answers Beverly can provide since she is the expert. Um, I don't think it would make sense if you ask me because I don't know. I'm just going to ask her. Um, so, I mean, while you're in here, no question is off limits, if it's pertaining to the topic. Um, if we have time, we can get to those. And if not, in the recap, um, if she has the time, she can answer the week recap questions, and I just put it in there. So, with that being said, we are back with another episode of Sister Care Sessions. I am Tisha Lachey, and I'm the founder and CEO of Sister Care Alliance. We are on part 4 of our
Mhm.
reproductive health series. This is the second to the last. You can watch parts 1 through 3 on the under the podcast section on the newsletter. Once again, we have Miss Beverly here. Hi, Courtney. Um, she's going to introduce herself. Then I have a special announcement, and then we can get into all the things. So take it away, Miss Beverly.
Yeah. So good evening, everyone. Thank you all for joining, and I'm sure more people will be coming on as the hour nears 7 o'clock. I am a reproductive biologist. I've studied human reproduction for about 20 years, bachelor's in biology, master's in reproductive endocrinology, physiology, and currently a doctoral student. Um, and I've been an educator for a really long time, so I get really excited about doing this work and reaching people. And I'm excited about today's topic. And we always end up where we end up, but we are going to start with a review of um, some of the information on the male reproductive anatomy because that becomes really important in understanding how birth control works. We have to know what we're trying to control. and then get as far as we can into pregnancy, because that's also, I think, a very interesting topic.
Okay. The special announcement is that Sister Caroline's is an affiliate with My Happy Flow, which is a supplement. It helps to alleviate cramps and heavy flow. Now, this is a product that I've used in the past. If you are a fan of the blogger Nicole Bitchie many years ago, she has transformed her career to Exo Nicole, which I was once a contributor to that site. And now she's into, I think at one point she was fitness modeling and competing. And so now she has branched off into this whole other spectrum of helping women with their cycles and periods and things like that. So I've used the product. It's good. It clears up my skin for sure, but it helps to alleviate cramps and heavy flow. It boosts mood and energy. It promotes clear and healthier skin. It regulates cycles and it supports healthy hormone balance. Like I said, I've used it before and it's good. You can get 10% off your entire order by using the coupon code SisterCare with no spaces. So 10% off your entire order using the code SisterCare. So, Miss Beverly, take it away.
All right. I'm loving all these partnerships that are coming up for the organization. It's really cool to see the growth.
Yeah, I'm excited.
Yeah, I mean, it's
Yep.
really cool to see that. So diving into, we had talked about, we're trying to center the notion of birth control. And if you notice, I'm using air quotes because if you know me, you know I'm gonna tell you some stuff that ain't nobody saying. So the first thing, what are we trying to control, right? Birth control is more of a marketing name. So because these synthetic hormones are also used to treat certain medical conditions. So you have to think about when you come into your your healthcare office and they give you birth control to regulate your menstrual cycle. You have to ask yourself, okay, well, if it's birth control, why am I taking it? And the reason why I'm very particular about how I use terminology is because the impacts that it had. So if you are a teenage young girl and maybe you're having going through adolescent puberty and there are some medical complications that are showing up as your body is developing, and in order to regulate certain things that might be occurring, heavy menstrual period, painful menstrual period, irregular menstrual period, right? They give you birth control. Your parents might think that that means that they're giving you birth control to intervene with sexual activity. And so there's harm in calling something that is actually synthetic hormone therapy. That's what it is, with the side effect of infertility. That's what it really is,
Ah,
right? So
so it's we've been
synthetic,
saying it the other way around for years.
yes. So it is synthetic hormone therapy. Okay. And the reason why it's synthetic is because there is a such thing as bioidentical. So, bioidentical. So, let's break those down. Okay. So, when people are trying to treat symptoms of menopause, they go often to bioidentical hormone therapy because the goal of treating the symptoms of menopause is trying to replace natural levels of that natural hormone. They're trying to get those hormones back up to a level so that the body can function normally. And so they might go with bioidentical. So, what that means, if we break that apart, is that the estrogen or the testosterone or the progesterone that you might be taking for menopause is identical to what the body would naturally be making because of the purpose of that hormone therapy. But birth control is also hormone therapy, but it is often synthetic. So instead of estrogen or estradiol, they'll have estrogens or progestins. And so when you look at the name of the type of hormone, it is likely going to be something that's close, but not exactly bioidentical. So I'm going to encourage you all to think of these as hormone therapies. There are many things that are hormone therapies, but their marketing name is taking away the several uses for which a provider might give you these medications. And make no mistakes, these are medications. They're not tic tacs. And with any medication, there are side effects. And the reason why there's so many different types of synthetic hormone therapy, which is what I'll be calling it moving forward, is because some things just don't work for some bodies. And also, depending on the symptoms that you experience, that approach to synthetic hormone therapy may have not worked for your particular biological makeup. And so you hear about this a lot where people will say, well, I took this and this happened to me, and I took this and this happened to me. And then you have like a group of 10 or 30 different women, and they will say that they took this and they had all these side effects. It made me feel this, I bloated, I gained all this weight. And so that is telling you already to be thinking about some considerations, not simply hyper focusing on preventing pregnancy, but to look at synthetic hormone therapy as something that has impact. Um, we just talked about for weeks how the endocrine system controls your entire body. So when you introduce synthetic hormone therapy, it's going to have other types of impacts than your desired impact because that's what hormones do. They do more than one thing. So it for example, um, if you have a history of heart disease in your family and you're going in for synthetic hormone therapy with the intent of preventing pregnancy, you see how I said that?
Mm-hmm.
Synthetic hormone therapy with the intent to prevent pregnancy, it becomes important to tell that family history because we talked about the role that estrogen plays in regulating your vascular system. And so they might want to put you in a progesterone forward or non hormonal uh, therapy in order to not increase the level of estrogen in your body because of the cardiovascular side effects that could occur. And I don't want to kind of lean into this because I believed in informed choices. And one of the
Mm-hmm.
concerns that I have with synthetic hormone therapy is that it is marketed in such a way that it's fine, just take it, don't worry about it. And I'm not saying that it's unsafe. What I'm saying is that anything that you put in your body, you should be informed about.
Right.
So this is not a binary, it is safe or unsafe. It is informed choices for what is best for your biological makeup, your family history, and any other pre existing conditions you may have. So it is not just take something because you're hyper focused on not getting pregnant. That is not going to be the only impact of these synthetic hormones in the body. Okay. So I want us to begin thinking about synthetic hormone therapy, just like I told you, I stopped saying period. Because when you say synthetic hormone therapy, it's different than saying birth control.
Yeah.
You immediately hear it differently. You immediately start taking it a little bit more seriously. But when you say birth control and everybody seems to be taking it, you're not asking a lot of questions because the only thing you're concerned about is that one thing without thinking about, is this the right product for me? Okay.
Mm-hmm.
And I'm hoping to just lean into that as we before we start talking about the different types. I want you to consider more than not getting pregnant. I want you to consider heart health, family history, weight. So certain synthetic hormone therapies are not designed to work with people over 175 pounds, right?
Whoa.
Timing to what works and what doesn't work for your lifestyle. Yes. So there's if you are not informed before you take this synthetic hormone therapy, you really need to ask questions about what this is. And you really need to think about your family history and your medical conditions. Do you smoke? Because that will have impact. There are behavioral things that you need to consider before choosing the right synthetic hormone therapy for you. I want to emphasize that we're not talking about safe or unsafe. We're talking about informed choices based on a number of parameters so that you can make the right choice for you. Um, I see Courtney says birth control, synthetic hormone therapy had me waking up and like out of my sleep throwing up because it was too much hormones. So what you're speaking to is the amount, right? So there are different dosages in different types of synthetic hormone therapy. And that is important to ask. You could start with a lower dose of something and then titrate up, or which means go up. It could be, you have to ask, is there a weight limitation to the effectiveness of this type of synthetic hormone therapy? Right? What are the side effects of this particular synthetic hormone therapy? Are there things I should consider for long term or short term health? Has this been studied in the longitudinal studies? So I'm trying to give you
A word
questions.
that you could be telling the people so that
Yeah,
you smart up in there.
yeah, I'm giving you questions to ask because I've heard a lot of conversation online, and it's a lot of kind of physicians are saying this is safe, and then you have a lot of herbalists who are saying drink some tea instead because you don't want all these hormones. I'm not having that conversation. I'm having the conversation to give you information to ask questions and make an informed choice for you. So I think it's not healthy to get into a debate, but it is healthy to give you language and things to consider when you are making a choice about anything that is going into your body. And it's not about what happened to somebody else, because we're talking about your body. Because what works for your friend might not work for you. We are not the same. And so um, just want us to kind of, when we begin having this conversation, y'all know I don't ever go where y'all think I'm gonna go because I see this differently just because I've studied these things at the cellular molecular level. And so it's not about, for me, it is about giving you tools to ask questions. Now, I want to go into some some things that have recently happened with this particular I'm gonna get into how it works, but I want to say this before I forget, um, because I will forget. So what I have right here is this is an IUD,
Mm-hmm.
right? You see this long thing. Um, an IUD's insertion can be really painful for people,
It is.
and the painful approach to pinching a cervix, which we've talked about is an organ functional, and dilating it and inserting a foreign object. Thanks to a lot of conversation on social media, there have been new guidelines. So again, there are guidelines, and actually, this actually will be my dissertation project. Really looking at guidelines on a number of things and seeing what physician adherence is to those guidelines. Um, so if you are thinking about getting an IUD, I want you to research the new guidelines for pain management during that medical procedure. It is a medical procedure. Let's be clear about that. It's a medical procedure. For some people, it's very painful, not only the insertion, but the removal. And you have a right to pain management. Um, and so much of the lack of pain management has histories back in enslavement. So the history of the field of obstetrics and gynecology is built off the backs of white men who did experiments on enslaved Africans unanesthetized that carry forth into today's time where the contraptions, even the speculum, right? Those are contraptions that they created and tested on. Um, one pioneer of this monstrous behaviors. The name is J. Marion Sims,
Mr. Sims.
right?
Mr. Sims.
So we're in 2026 and still using his torture
Mhm.
devices in medicine, still believing that these organs don't feel things, still. And so now that there are more women who are physicians and who are listening to our patients differently, these guidelines are starting to change because these women are now going through these procedures and say, hey, what's going on? We can find another way. And so there's a revolution happening in women's healthcare, but it's slow. And so when you think about a procedure like an IUD, when you think about a vasectomy, we talked about that last week. Vasectomy, that is treated with care. They get numbed up. They get pain management. When men get procedures, they get pain management. When women get procedures, they're told to take 2 Tylenol. That goes all the way back to the origins of this field, that people are still practicing suggesting that Black people have less pain. And this is a study done in 2026, no, 2016, when they asked medical students about if Black people feel more or less pain. And they were still believing that Black people didn't feel the same amount of pain. So these things persist in medicine today, and we are still continuing with them. But I bring that up because this thing right here, if you are choosing this approach, you have a right to pain management. That's all I wanted to make sure we get out before I forget. If you're choosing this approach, it's a medical procedure and you deserve pain management. So you look up those guidelines and you take those guidelines with you to your appointment so that you can get appropriate pain management.
So there's one type, or because when I got mine done, they numbed my cervix, but I still felt stuff, and
Yeah.
the women I've talked to say that it was a very traumatic experience, inserting and taking it out. Um, but the only when I got mine done, I was only introduced to the numbing of the cervix. Is there other pain management choices that women have?
Yeah, you do have other choices. Like you just have to. I don't have all the details on the new guidelines. Um, Numbing the cervix is one we talked about. The cervix is not like this little tiny chunk of piece of thing, right? It might
Mm-hmm.
be insufficient, right? It might be insufficient. So you might need cervical numbing and other medication at the same time in order to get the procedure. So it's not that you don't numb the cervix. And some women's cervixes are not even getting numb. So um, it's just going in code having this procedure. But I think it especially if you've had this before, you say I've had this before. It worked for me medically, but the process was traumatic. I would like to explore other pain management protocols. I'm just giving you language, right? And if that person says you don't need it, then perhaps that's not the right physician for you. Um, so it's just I'm just giving you language because we don't even currently have birth control for males. Why? Because in the trials, when they offer these trials, men don't like the side effects, so it never makes the market. So then women are burdened with the responsibility of altering their hormones in order to prevent pregnancy. So again, patriarchy is always kind of at the root of these things. Um, but I
They
wanted
quick
to.
to make Cymbalta though.
Are you talking
They're
about
quick.
Viagra?
They're so quick to push the blue pill. They can't
That's
put it in the
Viagra. That
birth
ain't
control.
Cymbalta. It's what is Cymbalta? I thought that was like a mood thing.
Is I don't know. I think I remember seeing it during the football season. I don't know.
Yeah, I think you're talking about Viagra. But Viagra actually wasn't made for that. It was a side effect. It was being made for something else. It was a side effect, and then it became.
What?
That's what I mean about medication and marketing. Medication and the marketing isn't always what medication was intended for, but in some way there was a side effect, and the side effect became more popular, and then it was marketed in such a way. So that's why I'm bringing up that marketing piece of medication because oftentimes when something was created there may have been a different intended purpose, and then they found this happy side effect and they're like we can make money off this, so let's market it for that. But yeah, so I wanted to get into that. So let's get into what synthetic hormone therapy. How does it work? Um, where's my eraser? So it works in four ways. If when you were specifically talking about hormones, so it's really going to try to stop ovulation. That's one way. So if it can prevent the LH surge, the surge that will lead to that ovulation by kind of rewiring that hormone track, dampening that hormone track, then that's one way that it could prevent it. It will thicken mucus, right? We talked about why I'll just ask, why would thickening mucus be important?
Um. Well, the first thing that came to my mind is to create that extra layer, extra barrier
To what?
to the uterus
From what?
from the sperm.
Yeah. So remember, we talked about how, the sperm has to swim rapidly forward and the body will naturally attack sperm because it is a foreign body. So if we thicken mucus, we make it difficult for sperm to reach an egg. for sperm to get through the uterine, the vaginal canal, to get through the uterus to the fallopian tube where it would meet the sperm. So that's what thickening mucus would do. And then we have thinning uterine lining. Now, why would that be important? I'm pretty sure I didn't spell that word right. Oh, yeah. Why would thinning the uterine lining be important?
uh, the menstrual not. I don't know if it's. I feel like I've got wrong information. Okay, when you're on unsynthetic hormone, you still spot. So is that considered the thinning of the lining? Is spotting that, or just spotting is just spotting?
Um, so spotting may be related to that, but we're talking about what does the thickening of the uterus lining, what is that for? So if we think about the uterus, so this is, and we have this
Mhm.
lining, and every month it's going to grow and get thicker. What is it preparing the uterus for?
For a pregnancy.
What specifically? We highlighted at the last part of the section. So if a sperm is able to go to the fallopian tube, meet the egg, it's going to go down here and it's going to implant in that uterus. Implantation into the uterine wall. All the things that the uterine lining is growing into is to create an environment that would be hospitable and nurturing to a fertilized egg. So if
So
we thin out,
thinning it will decrease those chances.
yes, so it makes the uterus less hospitable to a fertilized egg, and it may prevent implantation. Right. So
Okay.
so all the mechanisms that would lead to pregnancy, synthetic hormone therapy will try to stop ovulation, thicken the mucus to make it more difficult for the sperm to meet the egg, and then thin out the uterine lining so that if there was fertilization, it makes it less hospitable to implantation. If there's no implantation, there is no pregnancy. So that's implantation is the start of pregnancy, is the key. So that's what's important about that. So um, we've got a lot of options, and I'm going to highlight kind of the different ones. So we talked a bit about the IUD. The IUD, this one is the hormone-based one. The IUD is what would be in the family of called a LARC. Do you know what a LARC is?
I do not.
So these are long-acting reproductive contraceptives, right? So long-acting. So what does that mean?
Uh, I guess when it refers to an IUD, it can be implanted for a longer period of time before it has to be removed and replaced.
Yeah, that word just went all the way down to the other side. Um,
A crossword.
I hang man. Yeah. So for some people, they will take a long acting synthetic hormone therapy because they know that for a period of time they have no intention of reproducing, and or they may take it because there is a medical condition um, for which they are managing for a long period of time. So IUDs last for how many years?
I think it's 5 years.
Yeah. So that's a long acting versus a pill, which you have to take every day in order to maintain its usefulness. Now, I want to get into the the pill, um, because there are many versions of this. You really need to ask what's in this. Not because I'm worried about whether it's going to harm you, but you should know what's in this. Because if you don't know, I think Courtney has provided some information about dosing and how that can work, and then how ultimately even lowering the dose that it just didn't work. It's likely that the type of hormone that was in it didn't work, which doesn't mean that you couldn't find a hormone therapy. But remember, these are synthetic. So you're just like, okay, this type of hormone didn't work for me. Can you give me options that have a different type of hormone? So that's the question. Because what will happen is you'll take something and it is awful. Like what Courtney said, it's awful. So then you're like, I don't want to take no more of these shits. I'm not doing
Yeah.
this to myself no more. But really, what it is the type of synthetic hormone that was in it. This didn't work for you. Remember, I said that right at the jump. Before you shared your story, I said right at the jump, there are many different types of synthetic hormone. And they're because they're not bioidentical, the body, some will respond well and some just won't. Now we notice that we'll have like 3 of these pills and then this last week, and everyone will say, what's in this last week?
I don't know.
Well, that's also true. People don't even be knowing.
I have no clue.
That be part of their problem. So often people think that the last week is like a sugar pill because maybe this is the week that you're on your menstrual cycle, so you don't have to prevent pregnancy because you're on your menstrual cycle. But you don't know that. Sometimes these are iron pills. Sometimes they're a lower dose of hormone. That's why you got to ask these questions and stop listening to these friends. Because what's true for what she's on, yeah, it might not be true for what you on. So you have to actually ask, is it important for me to take all 4 of these rows? Because what happens is people take these 3 and then be like, oh, I ain't nothing in this, sugar pills. And this, it was relevant. And then all of a sudden they like, oh, no, I was on birth control and I had a baby. Every time I hear that, I'd be like,
Yeah, take that last room.
yeah, we do the same stuff. Like, I'm like, because it's like, are you taking it correctly? That's why people use LARCs, because they don't have to think about it. But this is something you have to take at the same time every day. Because remember, hormones are fluctuate. So you got to try to keep these hormones at a certain level for them to work. Right. Courtney said the doctor been telling me.
You really be telling these things, though. Yeah.
They only have 15 minutes. They got time to be doing an hour-long presentation. That's the challenge. The challenge isn't that your provider is inherently trying to play you. It's just a limited amount of time that they have to be explaining these things. So that's where sister care and scientific motivation comes in to fill in those gaps. So you want to
also you can do a follow-up. Okay, do another 15 if it need be. Shoot. I remember I walked out. I was the last appointment. It was dark in the office, not a nurse in sight. I was like, I got all my questions off.
Not for keeping the people at work. The nurse left. I was like, I'll get paid enough for this. But so I want, it's important. Oh, she said she need, girl, they ain't got no hour to give. But ask a question: what type of hormones are in these? And in all of these, are they the same dose? Is that last week something relevant? Or is it really just a placeholder to keep you in the behavioral pattern of taking it? You need to ask, because if you don't know, you could assume, and then now it's ineffective. So I want to mention that. We talked about IUDs. Then you have like things like this, which are various versions of these implants. This is a LARC because these can last in a body for a number of years. Sometimes there are multiple.
That goes in your arm?
Yeah, these will go under the skin, and they will slowly release a hormone. And some people really like them because this can last like up to 3 years. And then you can have that removed. And some people don't want something under their arm. But you also, even with that, you want to ask, what is in that? because everything I'm showing you, there's more than one version of them. There is no one version of the pill. There's no one version of an IUD. There's no one version of an implant. There's no one version. That's why there's so many different versions. So you have to ask what's in it. And if you've taken any version of that synthetic hormone and it didn't work for you, maybe you should say, well, what other options are there? Because there are a lot of options. I want to, before I get off of the hormone stuff, I do want to highlight emergency contraceptive, right? Often generically called the Plan B. So this is why I want to talk about this, because I don't think people understand how it works, and we just be doing stuff. So
I heard that you have to be a certain weight for it to be really effective.
that's true for a lot of the hormone therapies. Like 165, pounds for some of them is the limit. You just need to ask. That's not true for all of them, but for some of them, there is a weight limit. So, in order to understand how emergency contraceptive works, you have to understand the menstrual cycle. That's why we went over that stuff first. You also have to understand sperm, which is why I talked about sperm. So, how long does sperm stay in the body? What do we say?
I want to say five. Five keep popping up.
5 days.
5 days. Okay.
So, Courtney, I'm going to explain why so many people are getting pregnant from this, because it is not a guarantee. It is an option that if certain conditions are met, it will be effective. So they're not, I want to reframe what you're saying. People are not getting pregnant from emergency contraceptive. They've taken emergency contraceptive and still got pregnant. That is a very different sentence. So they took emergency contraception and they still got pregnant, and it's because certain conditions were not met. So first thing we needed to understand is how many sperm are released in an ejaculate. What did we say? Is it 5? Is it 10? Millions.
Yeah. Yeah.
Millions, hundreds of millions of sperm. Now I want you, that's it. Now let's take that information. So we've got millions of sperm. Okay. So that's a factor that you cannot ignore when we're talking about any form of contraception, is particularly the Plan B, right? So you're not contending with one sperm and you take this little extra dose, a couple of pills for a few days, and that solved the problem. And we just said that it stays in the body for
5 days.
5 days. So they can still be around in there. So I'm trying to help you understand why this may or may not work. All right. So you have to take it's 72 hours is your window after intercourse to take a morning after pill for any type of sex. But what did I just say? How long did the sperm last?
5 days.
Is that 72 hours? How many days is this?
That's 2 days.
No, it's 3 days.
Oh, 3 days. Uh-oh.
So we already starting off with this might not work.
Yeah, the ratio goes off.
Because the sperm could still be there. So what it's trying to do is delay ovulation. It's trying to delay ovulation.
And Courtney said, "But what if you're ovulating?"
That's the question. See, now we cooking with grease. Now we cooking, right?
Yeah.
So, but what if you've already ovulated? So that this step didn't work. It can't work. It missed that step. So there you go. So we got 5 days sperm and ovulation already done happened. Okay. It's going to thicken the mucus. But is this instantaneous? Do you think the mucus is thickened when you take that first pill?
No, I don't
That
think
take
so. No.
time. And in the time that this pill is supposed to be working, what's going on with these millions of sperm?
Five
They doing what they
days.
do. They doing what they do. They're racing against the clock.
Yeah.
They're not waiting for these 72 hours. They're doing what they're programmed to do. So I hope this is making sense why, you got a set. This is a chance to prevent a pregnancy. That don't mean it will, because if you've already ovulated, if you've already, say you wait the damn 72 hours, right? So you had the event with the sperm, you going to work, picking up them kids, you gonna go get it tomorrow. What's the sperm doing in that time frame?
It still got to do what it's
It's
going to
doing
do.
what it. So you wasting time. Like, so you waiting days, and then you decide on the 72-hour day, you 3 days later, oh, let me take this pill. Oh, this pill didn't work, bro.
Yeah.
You should have went to get this that day. Like, so a lot of it has to do with people not understanding how the male anatomy and their anatomy, and thinking this is some magic pill. No, it is. You know what's in this? Do you know what's in this? It
I
is.
do not.
Yeah, and that's the other thing. People don't even know what's in it and expecting all these miracles. Where my little thing? It's essentially this, just a
Okay.
higher dose. That's all it is. It's the
Mm.
same. This is really just about the same thing. Just about the same thing. This is just a higher dose. Remember, I just gave you all of the what it's supposed to be doing. Ain't that the same thing that these are doing? So
Yeah.
if that's what happens when we don't have knowledge, then we just be making up shit. And we just want a magic pill. That's not how this works. We are competing against all these sperm, and they are not waiting for you to hit up no Walgreens. This time management, it is the key. But at the same time, if you've already ovulated,
It's going to do what it do. But
you
but like
might
you
not
said
work.
earlier, it goes back to the marketing. I remember at one point in time, I would see Plan B commercials all the time on TV, in the newspaper. It was they was really trying to push it as the one stop shop of not getting pregnant.
Yeah. So when we don't know how our bodies work and we don't know how our partners' bodies work, we we make assumptions and we make choices that are not informed because we think the morning after pill is magic. It's a magic pill, and it's not. It's just doing the same thing that other hormone therapy, synthetic hormone therapies are doing. It's just a higher dose trying to work at a faster rate. But sperm is not waiting around
Sperm
for
don't
none of this
sperm.
to kick in. It ain't waiting for
Sperm
it to
is
kick
don't
in.
sperm.
Right. And there's too many of them. And they so I'm not
Yeah.
saying it can't work, but it will work under the right conditions. Do you see what I'm saying?
Yeah.
Under the right conditions, this can be effective. It is not a magic pill. It is also not an abortion pill. It will not terminate an active pregnancy. It will not. It cannot, because
Mhm.
its role is to delay ovulation and thicken the mucus. If it can't do it, that's it.
Yeah.
So it will not terminate it already. If you already was pregnant when you decide to take this, well, you just wasting time. Like you're just wasting money.
And
So,
money.
yeah, wasting money. That's not what this
Yeah.
does. So it's really important to know what it is and what it ain't. But
I think also a good thing that you pointed out is what would work for Sue won't work for Sally. So
yeah,
although you may chop it up with your friends and they say, girl, just take this. Again, it probably worked with her body. It might
Well,
not work with you. You know, you have to
here's another thing.
dig a
People
little
be
deeper.
lying. That's other. I've been doing this work a long time. Lies. A lot of these conversations is lies. Just lying, just saying anything because people don't be knowing what they're talking about. So they will say that they did a thing and it worked for them. Hey, they have no idea that they may be infertile. They don't know if their partner is fertile. So there's so many factors at play. That's why you can't listen to other people. One, because they be lying. Two, they don't be knowing what they're talking about. Three, you don't know their medical history. And the reason why they think this magic pill worked for them is because they was never going to get pregnant anyway. Right. So you don't know. And also, again, people be lying. I've been doing these workshops in all kinds of environments. And the things that I hear from people is why I started doing these workshops because people do not know anything about the system and just make up these lies. As Courtney said, people lying. So you can't be listening to people about what they said they did and they didn't do. They say they got their tubes tied and they got pregnant. Did they get the tubes? They can't listen to all of this stuff. Like people, I had a vasectomy and I got 3 kids. Did you get the vasectomy? Lies. People just be lying. Some of these things are impossible, right? So, especially for some reason around the reproductive system, this is like lore. I can't tell you how many stories about people said they did and this happened and it lies, biologically impossibilities, and a lot of it is just how would you know? Just be listening. Courtney is cut up. So that's what's important to know when you're trying to do emergency contraception. It's just a higher dose of what would be in other synthetic hormone. It's not an abortion pill. If you're already pregnant, it ain't gonna work. Sperm lasts 5 days in the body. You're contending against hundreds of millions of sperms. It's supposed to delay ovulation, thicken the mucus, but it takes time to take effect. So the sperm ain't sitting around waiting for you to take these pills. So if you try to wait till the 72nd hour to go take this, it might be a wrap for you. So in 48 hours, fertilization may have already occurred. So it's not a magic pill.
Yes.
It's not a magic pill.
Walk into Walmart, turn around, you done.
You best just getting up and driving right to the store. Don't be trying to go to work and take a nap and all this kind of the sperm is moving.
Yeah.
While you taking your time, the sperm is not taking time. So maybe on the day of the event, you had not yet ovulated, but they in there for 5 days. Yeah. So somewhere between the 2nd and 3rd day. So if you don't, you have to understand how your body works. Otherwise, lies. Now, what's also important, so we've talked a lot about like hormone-based contraceptive or synthetic hormone therapy. I want to emphasize that none of these things prevent any version of sexually transmitted infection. None of these things will prevent any version of sexually transmitted infection. That also includes this, right? So these are called barriers. They're called barriers because they prevent the sperm from entering into the vagina. They're barriers. Non-hormone based, they're barriers. But if you think about anatomy, look for where's my male anatomy thing? So if there is, I'll use this. So if you have, so we have one thing, if you remember nothing else I said, this is a vulva, the canal, the tunnel, that's the vagina. So your outer part is not your vagina. Mm-hmm. That's not the vagina. That's a vulva. The inside, the canal, that's your vagina. It's a vaginal canal, the tunnel. So I know we use them interchangeably, but
Yeah.
no, the vagina is a specific space. The outside that you see is a vulva. So please add that to your language. Vulva, outside, inside, vagina. So that's important because these parts will touch other parts of skin during intercourse. So if there are things, warts, blisters on this part and it touches the skin, that's even if you have a condom, they touch the skin around the area, you can still transmit those things. Um, and I know we ain't supposed to talk about sexually transmitted infections because that's a whole other, I go in on these kinds of
I
things.
know.
But I just want to talk about because when we talk about synthetic hormone therapy, better known as birth control, there are misunderstandings of what it protects. It's only trying to either treat a medical condition or prevent pregnancy. It has no role in preventing any kind of sexually transmitted infection. And even though you might use something that is a barrier, whether it's this or the female condom that I have over there, um, the female condom does cover more space than the male condom, but still skin to skin contact with certain sexually transmitted infections still can occur. And I would have loved to have done a session on this because it's one of my favorite topics, but we ain't got time. We ain't got time. We already ain't got time for pregnancy. Um, see, we never have
I
time.
know.
We don't
I
ever
know.
have time. Um, the other thing that I will say is there's also contraceptive foam. So there are foams that you can use or creams that you can use which are like spermicide. So remember the whole point is trying to contend against the sperm. And so some people will use a barrier along with spermicide, but you have to be careful because sometimes the spermicide can make the condom weaker. So you have to think about the spermicide that some people use, which is just trying to kill the sperm. And also make sure that the pH is okay so that you don't get some kind of infection. Um, yeah. So I hope I covered. I tried to stay light today and we still went to it.
Yeah. All good stuff though.
Well, we have a few people. Are there any questions?
I know Courtney just talking. I know she got some questions.
I appreciate the
What is it, girl? um,
of
Empress
the
just
people who are on
joined.
here. Any questions about
Any questions,
contraception?
guys? No, not. Well, you know what? Don't come asking me because I don't know it. I'll go email her saying, "What's this?" But
So
I think it is. I think it is important to kind of reiterate that we need to be asking these questions before we ingest anything.
yeah,
Um, and from personal experience, I was heavily relying on the doctor so much that I didn't even. It wasn't even a thought to ask, and so by the time I really knew about certain things, it was too late. I've already got it. So I think it's important just to ask, ask those questions.
I think the ability to one of the reasons I started doing these conversations, these exercises, and I've taught all ages, high school, middle school. I've taught all ages with this and many other subjects. Is because my goal is to destigmatize the conversation. So people not asking often comes from limiting the conversation. Like today, we are talking about synthetic hormone therapy, better known as birth control. But for the most part, we were talking about intercourse at all. We weren't talking about that at all. And so when there's shame associated with this particular organ system, you're less likely to tell the truth about your behaviors, tell the truth about your questions or concerns, or talk to anyone partner or whomever about any symptoms that you may or may not be having. And like if we had time to go into STIs, which again, the way I do it be fun, you would walk out of there with all stigma removed because it's just microorganisms. Not even a, you know, it's we've created this feeling around it, which prevents people from talking about it. When we're talking about um, synthetic hormone therapy, especially when you're using it for treatment, it's important not to call it birth control. Because if you're using it to treat a medical condition and you call it birth control, if
Yeah.
you're young and your doctor says this person's having an irregular menstrual cycle, you want to provide this, then your parent might say she's not taking that, she's not having sex. So the way we even name these things can become limiting for healthcare providers to provide treatment for things that people are experiencing because we're calling it birth control, um, and not giving it the fullness of the magnitude of what it is used for. It is in many cases, a necessary mechanism for treatment for a number of different medical conditions, which is why I think we need to recampaign to expand the title associated with synthetic hormone therapy, because that will allow for people to be more open to taking it if they understood that it has more than one function.
Mm-hmm.
And if you take nothing else away, I hope you take that away from this. And when we talk about like pregnancy, which again is a whole other hour, um, you understand that we where we've gotten to in 2 sessions is implantation. This is your uterus. That implantation, that's key. The hormone that when you pee on the stick that you're looking for, human chorionic gonadotroph, that's that is the key to the beginning of pregnancy. And progesterone is needed to prolong and maintain the pregnancy. And so, what you might be given, should you be having issues during your pregnancy, you might be given hormone therapy such as progesterone, which might come in the form of what someone might think is birth control. See what I mean? They might give
Yeah.
you additional progesterone to help your body maintain that pregnancy. We are doing ourselves a disservice by not calling things by their proper names, because of the stigma and socialization around these things prevents people from their willingness to take the medication that they need and understanding how their body works. It is a disservice.
Mm-hmm.
So, you know, even if I don't go through all of pregnancy, understanding HCG, that is the hormone that tells your body there is a baby being formed. And that will change the entire functions. So many things change in your body. So many things change. And all it's doing is preparing your body to not just birth an offspring, but to feed it. And that all starts at implantation. So, right now, if you are not in a pregnant state, you're not producing milk. That hormone's not doing that thing. Those milk ducts aren't doing what they're, but that's going to start happening in preparation for that birth. Your
Yeah.
body's going to release things like that's called relaxin. So you notice when people hit that second, third trimester, they start waddling. You think it's because the belly getting big? No, it's actually that your body will release a hormone called relaxin that does exactly what it says it's doing. It's relaxing those muscles because it's got to push this baby out. So your body is going to go through a complete shift. And for some people, they go through these very beautiful pregnancies where they just have this little bump.
Yeah.
And then they pop the baby out on one pump push. And for those like me who transform into a creature, because like when my body began to shift hormonally, it was such a hard thing for my body that I didn't
Mhm.
even look like myself at the end. Like if you saw the day I delivered my son, you'd be like, "Who is that?" So there's so many things that are happening during pregnancy that a baby, a fetus, is technically a parasite, right? So a parasite is something that lives off of something else. So a
Mhm.
fetus is that, and so it's using all of your resources and nutrients in order to form, right? And so you have to consume more calories, you have to eat certain kinds of things, you get cravings. Even though like people talk about the cravings, our bodies crave things often because it needs a nutrient. But
Yeah.
because we don't eat that way, we think we want cookies, right? So we don't understand. Like when I started going through perimenopause, I noticed I don't eat like a lot of red meat, but I need a steak like every day, and I'm like, what is going on? It's because I now need more iron. So my body
Mhm.
is asking for iron, and I'm interpreting that is beef chunks, right? Right.
Yeah.
Beef chunk me, right? So when we have these cravings and we don't know how to associate the cravings, which is what the body is, you're now eating for another or more persons, and your body's saying, we need an extra dose of these nutrients. So it's going to crave something that hopefully will lead to those nutrients. That's what those cravings are about. Our bodies are incredibly intelligent. It knows what it needs. We don't know what it needs. That's the thing. We don't know how to listen to that, to say, oh, I've been drinking a lot of water. What is that telling me about my body? I'm peeing more frequently. What is that telling me about my body? I ate this thing, it disagreed with me. What is that telling me about my body? We don't know. So we blame the thing instead of saying, do I got celiac disease? Right. We don't ask those questions. So when we're pregnant and things start changing, breast will grow, right? Because they have to now produce milk, right?
Mhm.
You're gonna have a widening of the hip because you got to push that baby out. So your body's going to do that. And then what's so cool, and I know we running over time, but I want to say this, like, what's so cool, if you look at natural birth videos, um, just watch them. I mean, you don't have to watch all the gory stuff, but if you just watch how naturally the body knows how to do what it needs to do in order to deliver the baby, it just knows. And you have this process that tells you that it's a step by step process. But if you are in tune, you can pay attention to the step by step process of your body preparing for the pregnancy. It's preparing for birth. And you will notice like a woman says, I need to push. They know they need to, they never pushed a
Yeah.
day in their life, never had a, they know they need to push. What, and then they know when they need to do a thing. And when babies are born, they know they need to suckle. So there's so many natural things that our body is designed to do. Now that doesn't mean that there aren't interventions that are necessary, but on, if we're talking about a non-complicated situation, the body has this natural understanding. But what people often misunderstand is that after you deliver the baby, you got to deliver something else. And what
The
would that be?
placenta.
Yes. What is the placenta?
That helps feed the baby, right?
It does.
Isn't it like attached to the uterus somewhere and it helps feed the baby?
Starts at implantation. I keep telling that
Mm.
implantation is so much more important than you could ever know. If we had time, I could go into how the type of implantation can lead to preeclampsia. This is the most important piece of the whole puzzle. Because if this ain't right, it ain't gonna happen. So
Yeah.
implantation, so right there, it's gonna like burrow a bit into the uterine wall, and then it's going to grow out from there. And that belly button that we all have, that's that connection to that placenta, so that we can now receive nutrients from the host. It's our tether. But when you deliver the baby, that baby is what that's the sac that the baby is in.
Zach.
So I'm about to schedule an appointment to get some blood work and understand why I'm wanting greens. Cutting up, you're cracking me up. But like so when we think about delivering this placenta, which is, if you look at all animals, many animals eat it. It's this nutrient dense thing. What will happen is after you deliver the baby, in some cases, like in a more natural environment, you can stay attached to the placenta for a while and um, hold the baby. You don't need to cut it right away. Those, unless there's a problem, you don't need to cut it right away. But your body will naturally give a contraction for placental birth. Yeah, the body will give. So you get your contractions to get the baby out, and then there's a pause, and then depending on what type of birthing process you're having, the body will then let you know when it's time to deliver the placenta. There will be a contraction, and then you will have to push the placenta out. And the body is so amazing. It's so amazing how it knows how to do these things.
Now, does it stop providing nutrients once the baby's out?
When you cut it, in some practices, depending on indigenous different cultures, they keep the placenta attached inside the mother for a short period of time, and they have their reasonings for that. That's not necessarily an American Western society of practice, but once it's delivered, then you want to remove it, because remember, it's attached to you. So it needs the blood supply is coming from you. You actually, during pregnancy, your body is going to revascularize and increase blood volume 60%.
Wow.
Yeah. It's because of that why we have so many pregnancy complications, and that cardiovascular diseases in pregnancy, which is my dissertation, is the leading cause of morbidity and mortality, because some people cannot handle some of the pregnancy induced, we call them pregnancy induced changes, right? And these pregnancy induced changes will alter the environment so heavily that clinicians call pregnancy a stress test for the body. It's such a heavy hit hormonally, neuromuscularly. It's a huge hit to the body, and for some people they can handle it and it's fine. And for those like me, I was a transformer, broke down. They was like, "You don't you do this again? This is it for you." They were very clear with me. Don't do this again.
Yeah.
So for some of us, our bodies just didn't handle it in the way that others who just popping them out. That was not my experience. That my body didn't return to its previous state immediately following. It didn't. It took me a very long time to recover from pregnancy and childbirth. And for some people, that's not their case. But our biologies are not exactly the same. It was very difficult for me on my musculoskeletal system. I was on a cane for a year after I gave birth. I'd never been on a cane in my life. I mean, I really went through it. It was like, you don't need to do this no more. And then I didn't. So like, yeah. And for others, they're fine. So yeah.
Wow.
Yeah, I feel like we touched on a number of things. We got to a bit about pregnancy, the placenta, and you said that's where the baby's at. The baby is in an amniotic sac.
Yeah.
It's not inside the placenta.
Yeah.
Yeah, those are two different things. The placenta is the supply. The amniotic sac is what the baby lives in. Those are two different things.
And also, I want to state that, Courtney, you do have two kids, which is beautiful. But I don't want this. I don't want you to feel shameful about it. You didn't know what you didn't know, so now you do know. And if you want a third child, you know the steps to take for that to happen. So I don't want you to feel shame about it. This
Well,
isn't
I think that
the space for that.
I also want to encourage you that I've done this workshop with people who got PhDs. And I was going for an ultrasound when I was having my own reproductive issues, and I was with one of my sorority sisters, and we were sitting, and she pulled up her screen. She was like, "This shit a PhD in a science, mind you," and she pulled it up the uterus, and she said, "Now where the baby be at?" No joke. So there is no shame because this conversation is often not had outside of people who train in this
Yeah.
shit. That's just reality. Like, and so it doesn't matter what your education is. You may have never, even if you have 5 kids, and I've had conversations with people who've had multiple children, they were never explained how their body works. But here's the beautiful thing. Even not knowing, you were able to still do what needed to be done.
Yep.
That lack of knowledge didn't prevent you from creating and producing life, because life gonna do what it's gonna do, and that's what's beautiful about
Yeah.
the body. It don't need us to understand to do what it's gonna do. We need to understand it if there are problems so that we can communicate, but it's gonna do what it's gonna do.
Yeah. That's a good place to land it. Um, any take like a key 2 to 3 takeaways that we all should be um, really focused in on.
Yeah. I think we need to rebrand synthetic hormone therapy, because I think it prevents people accepting of it for treatment, and it prevents deeper conversations about what's in it, how it works, and how it can be used for multiple things outside of just contraception. If you are having a medical procedure, you have a right to pain management. Please look up the new guidelines around IUD insertion. And even if you ain't got the new guidelines, you have a right to pain management.
Yeah.
I think it's important to understand that the vulva and the vagina are two different things. Vulva is on the outside, the vagina is the canal. And understanding that it's important because the skin on the outside, oh man, if I had time, the skin, it's just skin like this. And so it's subject to
Mhm.
different medical issues than the vaginal canal because it's different materials. So there's that. Plan B is not an abortion pill. Plan B only works under certain conditions. It is not a magic
Yeah.
pill and not a guarantee. So I can leave it at that.
And people be lying. People be lying out here
I
still.
promise you, they lying. I have heard all that they be lying. Stop listening to these people. These stories be mad wild. There is no, we just told you, hundreds of millions of sperm. There is no sexual position that's going to give you a girl or a boy. That's not how it works. It's a
Yeah.
biological impossibility. So that's a bar. People be lying.
All right. Well, as always, thank you, Miss Beverly, for dropping gems and knowledge and all the things. Thank you guys in the chat for adding to the conversation. As usual, the replay will be posted tomorrow, also on YouTube. And on Monday, I will be back here with another live with Janice McBride. Finally, I get to be interviewed for once. So we're just gonna talk and chop it up, and that will be out too. So if you have any questions, DM me, email me, and we'll
I know
get the
Courtney
answers to
said she
you.
was going to, don't message me because she'll tell you right now. I don't even know which one is my Substack.
Yeah,
So
yeah, yeah. Yeah, message me, Courtney. Yeah, message me. I'll see it before she do.
she'll text it to me because I don't. Last night, my son had to help me realize why I had two different Substacks. I didn't even know what email address was attached to this. I just be logging in and not knowing which email address I made this with and just picking email addresses and making new ones. So don't, and it's not because I'm not tech savvy. It's because I got too many things going on. And I don't remember my
Yeah.
passwords. So,
Yeah.
so in fact, I didn't even know I had two of them. So Tisha's like, which one? I was like, I got
Yeah, you got
two.
two, and I add them. I add them every single time because I don't know which email is gonna hit first. So we'll
I'm gonna
just
text you
like a
because
luck
we
of the
did. My
draw.
son and I figured it out last night. We know which one is which now, but I
Okay,
swear I didn't even know I
perfect.
had two of them because I couldn't remember which email address I used. But yeah, don't try to message me on there; it'll be in the ether. But Courtney, thank you so much for your
Okay, ladies.
participation.
Yeah,
I appreciate that. That
yeah.
that that makes this a lot fun because you had us cracking up.
Courtney, she's good. She when she finds the time to join me, she adds a lot to the conversation. So thank you, ladies, who joined. Again, thank you to Miss Beverly, and see you the next
Yes.
time. All right, everyone. Bye.